video, we are going to focus on the age-related changes of our residents. We are going to look at what normally happens to the body during the aging process. We are also going to look at some of the negative functional consequences of aging, as well as the interventions we can perform. From birth to death, we are all unique individuals. Our residents will age as individuals, each with their own weaknesses and strengths. It's not the chronological age of a resident that is important to us, but rather their functional ability as they age in our residential care facility. For example, you may care for people in their early 60s that are very frail, very dependent upon you for many of the activities of daily living. On the other hand, you may care for someone in their 90s that can run circles around us. So what matters to us is the functional ability of the resident, and also what can we do as care providers to enhance their quality of life.
There are three parts to our ear, referred to as the inner, middle, and external ear. And as we age, we experience changes in all three parts of the ear. In the inner ear, the older adult can experience narrowing of the ear canal and possibly a decrease in blood flow and neurons, which can impair the functioning of the ear. The middle ear, which is a part that contains the eardrum, will experience things like stiffening of ligaments and possibly even a stiffening of the eardrum itself. And finally, in the external ear, there are perhaps less significant changes, things like increase in hair and changes in skin elasticity and color. Now, because of these physical changes that are happening inside the ear, the older adult is prone to some negative functional consequences. An increased risk of impacted cerumen or earwax. Additionally, the older adult may experience a condition called presbycusis, which refers to a difficulty hearing high-pitched sounds. This is why older adults in our facilities often have an easier time hearing low-pitched voices or tones.
This is what you can do for a resident that has a hearing impairment. First of all, sit in front of the resident or stand in front of the resident if you are going to be speaking to them so they have a clear view of your face. Do your best to avoid background noises. Turn the television down. Take the resident to a quiet area if you need to have a lengthy conversation. Assist the resident with their hearing devices. Many residents will wear hearing aids. You will want to familiarize yourself with the manufacturer's instruction for their care and operation so that you can help the resident with their hearing aid. Every morning, remind or assist the resident to place their hearing aid. Make sure that it's adjusted to the proper level. In the evening, you will want to help them remove that hearing aid. Oftentimes, a hearing aid must have the battery removed at night. Be cautious of the pitch in the tone of your voice. Make sure that you are not speaking in too high of a tone because that's harder for the resident to understand. Use a lower, natural tone voice. When assisting the resident that has a hearing loss, it may be necessary to encourage others around to use a proper tone of voice at the appropriate level as well. For example, if you are going to seat a resident next to another resident that they are just meeting for the first time, you may want to encourage that other resident to speak in a tone that the resident can hear. Additionally, monitor the resident for increased hearing loss. This could be an indicator their hearing aid is not working properly, or if they do not use a hearing aid, it could be an indicator that it is time for them to be reevaluated. How would you know your resident's not hearing well or their hearing loss is increasing? Some of the ways you'll know is that a resident will ask you to repeat things frequently. You may see them actually cup their hand behind their ear and lean forward so that they can hear you. You may also find that a resident begins to isolate themselves. They don't participate in group activities like they once did simply because they're embarrassed that they can't hear and participate easily. You may also find that a resident becomes a little more cranky simply because they're having a hard time understanding you, or they may misunderstand what you're saying. When caring for our residents, we must never clean the inside of the ear canal, only the external ear. Never place a Q-tip or other device down inside the resident's ear. You heard it discussed earlier that as people age, there can be a buildup of cerumen, also known as earwax. That is only for the professional to remove. So if you notice your residents having increasing difficulty in hearing, you may help them schedule an appointment with their medical professional, but never cleanse the inside of the ear canal.
To really understand the age-related changes that occur to the eye and to vision, you really have to understand some of the basic parts of the eye itself. On the diagram, you can see the cornea, the lens, the retina, and some of the key muscles that are involved in moving the eye and the eyelids. Some of the age-related changes that can occur to the eye include a yellowing or opacity of the cornea, an increase in size and density of the lens, a decrease in pupil size, and possibly a decrease in neurons and blood flow to the eye. These age-related changes can lead to negative functional consequences that include increased sensitivity to glare, a need for greater illumination or more light. It can become more difficult for the older adult to adjust to sudden changes in light. For example, if a caregiver goes into their room at night and turns on the light, it can be very difficult for the older adult's eye to quickly adjust to that. Additionally, some older adults experience a condition called presbyopia, which means a decreased ability to focus on near objects. It becomes harder to see things that are close to them.
Caring for our residents, we always want to make sure there is adequate lighting at all times in the facility. Even during daytime hours, it will be necessary to have lights on, especially if the resident is choosing to read or perform a close task. Remember, residents sometimes have trouble adjusting to a change in the intensity of light. So if a resident is going, for example, from a very bright room to a darker room, or for example, going from indoors to out of doors, we will want to encourage them to pause for a moment and let their eyes adjust to the different light level. Make sure that your activity and reading materials are in large enough print. In addition to large print books, you can purchase playing cards that have very large numbers on them, easy for the resident to see. It's not much fun participating in an activity if you're struggling just to see what's going on. Remind the resident to wear their glasses. In the morning, if they wear glasses at all times, encourage them to put their glasses on as soon as they awaken. In the evening, when you help a resident into bed, make sure their glasses are within easy reach. And by the way, make sure those glasses are clean. Sometimes our residents do not realize when the lens is becoming dirty, so we want to make sure those glasses are nice and clean. Use contrasting colors whenever possible. For example, a bright blue soap dispenser shows up much easier on a white bathroom sink than a soap dispenser of the same color. Dishware, make sure that it contrasts to the tablecloth or placemats that you might be using so the residents can see easily. If a resident has very significant deficiencies, you may want to contact your local Braille Institute in your area to learn even more tips. For example, at mealtime, if a resident has a very difficult time seeing, you may think of the plate like a clock and explain to the resident where the various foods are at. For example, you would let the resident know your Salisbury steak is at 6 o'clock, your peas are at 12 noon, and your mashed potatoes are at 3 o'clock. Additionally, never rearrange furniture without advising and teaching the new furniture arrangement to the resident, or this could pose a safety risk.
Some of the age-related changes we might see in our residents include a difficulty with chewing or difficulty properly chewing, decrease in the secretions of the stomach, a decreased motility or movement through the intestines, possibly a decrease in blood flow to the intestines as well. We also may see a decrease in elasticity of the stomach and of the intestines. These physical changes can lead to negative functional consequences that include difficulty swallowing, a lack of enjoyment of food, difficulty absorbing certain nutrients such as calcium, iron, and certain vitamins. Older adults are more prone to dehydration, and probably one of the most common and significant negative functional consequences because of these changes is constipation. As the intestines age and they become less elastic, and as we see a decrease in that motility or movement of the intestines, the older adult becomes much more prone to constipation. It may sound like a simple problem, but for an older adult it can be very serious.
Just like the beginning of the digestive process begins at the mouth, we want to think about good oral care for our residents. Encourage them to practice good oral hygiene. Assist when necessary. If a resident wears dentures and suddenly there's a change in their food consumption, you always want to think first, could there be a problem with the fit of the dentures? Dentures that do not fit properly can make eating very painful for the resident. Additionally, we want to monitor the resident's food consumption and report to the physician if you notice any significant change. If you're caring for a resident and you are trying to encourage adequate nutrition, but the resident just doesn't have much of an appetite, there are some things that we can do. For example, make sure that there are no unpleasant odors in the dining area. Make sure you haven't recently cleaned the dining area with chemicals that might have an odor to them that is not pleasant. If you have incontinent residents, make sure that their briefs are changed every time prior to coming to the dining room. You will want to make sure that the portions you serve are not overwhelming. Sometimes serving a large plate heaped with food can actually make the resident feel nauseous and not like eating at all. It's just overwhelming. Serve very small portions that the resident can feel successful in being able to complete those portions. Make sure the resident has the right table mates. Being seated with friendly people at mealtime can make a difference in how much we choose we want to eat. Additionally, serve foods that the resident enjoys and can easily consume. If bowel habits are a concern, report any significant changes to the resident's physician. However, some of our residents actually worry excessively about their bowel patterns. A bowel movement anywhere from 3 times a day to just 3 times a week can be within a normal range. So know what is normal for your residents so you know when to report something abnormal. If you're caring for residents with significant memory loss, it may be necessary to actually write down or chart the amount and frequency of their bowel movements so you can keep a close eye on that. If a resident has trouble with constipation, make sure you're following the physician's orders that may include things like encouraging adequate nutrition, making sure the resident is drinking enough fluids, making sure they're eating enough fresh fruits and vegetables and have enough dietary bulk in their diet. Activity also helps with constipation. Just encouraging a resident to take a walk a couple of times a day can be very helpful.
The cardiovascular system is undoubtedly one of the hardest working systems of our body. It includes the heart, blood vessels, and the blood that they carry. Some of the age-related changes that are seen in the cardiovascular system include a stiffening and thickening of our blood vessels, as well as a possible thickening of heart walls, particularly the left heart wall. These age-related changes can again lead to some negative functional consequences. It's important, however, to understand that many of the negative functional consequences seen in the cardiovascular system are a combination of not just age-related changes, but also significant risk factors, such as diet, smoking, alcohol consumption, and even genetics. These negative functional consequences can include many serious problems, including, of course, hypertension. As blood vessels become more thick and less elastic, the pressure inside those vessels increases. And of course, we know that hypertension itself can lead to many other serious problems. Other negative functional consequences can include an increased susceptibility for arrhythmias, an increased susceptibility for a condition called postural hypotension, which refers to a drop in blood pressure when a person stands up. It can make them very dizzy. Older adults may also experience something known as postprandial hypotension, which refers to a drop in blood pressure after eating. These negative functional consequences put the older adult at great risk for things such as congestive heart failure and heart attacks.
When caring for a resident with cardiovascular disorders, the most important thing you can do as a care provider is to monitor that resident. If you notice they're having increased shortness of breath or fatigue or a significant change in weight, particularly weight gain, we'll want to let that physician know right away. We'll want to encourage the resident to follow their physician-prescribed diet. It may include